So at my fieldwork, one of the policies or protocols that kind of impacted our work was when a patient was on a DVT or pulmonary embolism protocol. So basically, what these protocols state is that the patient is unable to be out of bed for 24 to 48 hours. And these protocols are obviously in place for the patient's safety to make sure that the clot doesn't dislodge, go to the lungs, go to the brain, go to the heart. However, for our OT and PT evaluations, they kind of hindered our 24-hour rule of documentation, which we get penalized for. So, what we did was we did an in service project, me and two of the PT students that were also doing their fieldwork at Baptist. We did research as to what the best method and if early ambulation was beneficial for the patients. So we found that for patients with DVTs, depending on the anticoagulant medication given, the bed rest monitoring period differed. So, for example, if they were given Lovenox, the rest period was only 5 hours, versus if they were giving heparin, it was the full 24. So, with this information, we were able to determine that if OT and PT were going to see the patients that were under these protocols, that we need to conduct thorough chart reviews in order to determine what anticoagulant medication they got, when they got it, and also if there was any other indications that the patient is not able to move. If the patient was still on a DVT protocol with, say, for example, heparin, we can put in like a PNA, which does still, like, it still hinders the evaluation, like, penalty, but it's better than nothing. Or sometimes we're able to conduct like just a bed mobility assessment or evaluation on the patient, and then once they are off of it, we go and reevaluate the patient. It does cause for more time that we have to go back and forth, but it is ultimately for the patient's safety. So our recommendation was to do thorough chart reviews every day, even if you knew who the patient was, to check new diagnostic results, if they had any blood exams, procedures, medications that are being administering, and also speaking with all the nursing staff to confirm that the patient is eligible to participate in therapy today, or if they can only do bed mobility interventions.